Good day everyone, I am Sharami M. Reyes and today I will be doing a return demonstration about female catheterization. So this is a medical procedure that provides or facilitates direct drainage from the urinary bladder of our patient by inserting a catheter from the urethra to the urinary bladder of our patient to permit drainage of urine. So this is also done with the patient who have difficulties in urinating natural relief, or it is also used before and after surgery when necessary. So prior to the conduct of the procedure, first is we need to check the doctor's order for catheterization so that we can make sure or we ensure that we do or we done a right assessment for the right patient. And next is we must perform a hand hygiene to prevent or to deter the spread of microorganisms. And then after that, we need also to prepare the equipment that we will be using for the assessment. So we have here the urinary bag, Foley catheter or two-way Foley catheter, kidney basin, and our set for or tray for catheterization. We need to prepare the equipment to conserve time and energy. Good morning, ma'am. I am Shara Reyes, your student nurse for today, ma'am. Can I see your wristband? Can you state your complete name, your age, your birthday? Okay. So, as your doctor's order, ma'am, since you have difficulty urinating, the doctor ordered a urinary catheter for you. So, today is I will be putting the catheter into your urinary bladder by inserting a catheter tube from your urethra through your urinary bladder to excrete, so that you can be able to excrete the urine from your bladder. Okay, so in doing the procedure is I will need to expose your genital area. Will that be okay, ma'am? Okay, thank you. And so before we begin with the procedure, ma'am, is I will close the door and the curtains for your privacy. Okay. So next is we will position our patient into a dorsal recumbent because this will help us to provide good visualization of the part where we will insert the catheter. And then next is we need also to drape the patient, exposing only the genital area so that our patient will not be embarrassed during our procedure. Then also we need a source of light like drop light so that we can accurately insert the tube. And then we need also to place our urinary bag into the bed frame of our patient, and take note that the urinary bag will not be below the waist level of our patient. So next is we need to get a pad and put it below to the patient's buttock so that we can prevent the linens from getting wet. Okay, ma'am, I will assist you and I will insert this pad to your buttocks or below your buttocks. So next is we need to open the tray set for the catheterization so that we will be arranging it for the convenience and to avoid contaminating the sterile item. So we have here the forceps, the working gloves, the cotton ball soaked in cleansing solution, we have here a eye sheet, we have also a lubricant, the empty for urinization or collecting of urine, and also the syringe for the inflation of the balloon of the catheter. So using the sterile forceps, we have to clean the genital area of our patient using a cotton ball soaked in betadine. First is we will start with the midline from the symphysis pubis down to the anus in one stroke. Remember, one stroke per clean. Then discharge into the kidney basin. Second, let's clean the labia majora starting from the further side, starting from the mons pubis down to the anus. The other side also of labia majora. Next is the labia minora, starting again from the mons pubis down to the anus. The other side. Discard, get a new one for the groin, starting for the further side, then zigzag up to the thigh. Get another one, do it in the other side the same way. Then next is we must also put our working gloves on to prevent contaminating of the patient's genital area while doing the procedure. And it will also help to protect our hands from getting microorganisms. So next is we need to place the eye sheet at the genital area of our patient. Then next is connect the catheter with the pre-filled syringe. This will be used to inflate the balloon when we put the catheter into the patient's bladder, urinary bladder. Next is we must lubricate the end of the tube for about 1 and 1/2 inch. Then we must carefully not to plug the eye of the catheter. So lubricating the catheter will help us to reduce or will help to reduce the patient's discomfort or pain while we insert the catheter to her urethra. I will now lubricate the catheter. Okay, mom, so now I will insert the catheter, okay? And I need you to relax. So using the one hand, we need to wide up the labia minora of our patients, and with the other hand, we will insert the catheter to the urethra. So we must insert the catheter for about 2 to 3 inches or until the urinary will flow. Then, next is to connect the urinary bag to the catheter tube and make sure that the urinary bag is closed to avoid leakage. The next is we need to inflate the balloon inside the urinary bladder of our patient by inserting this pre-filled syringe or the water in the syringe. So next is we need to tape the catheter into the thigh of our patient. So, inflating the balloon inside the patient will help so that the catheter will not be slipping out to the body of the patient. Then after that is we need to remove the eye sheet. Then this word. Okay, ma'am, so we are done inputting your catheter, and I need you to lift up your buttocks for me, ma'am, so that we can remove the pad. Okay, thank you. So we are done, ma'am. How are you feeling, ma'am? Are you okay? Okay, good. Are you comfortable, ma'am? Okay. So after we done with the procedure, we need to do an aftercare with the equipment that we used early. And also we need to perform hand hygiene again so that our hands will be clean. And also we need to document the procedure that we have done to the patient, including the time and date of the procedure, the type and the size of the catheter that we inserted, the amount of fluid that we used during the inflation of the balloon, and also the amount of urine and the reaction or the response of the patients.